How do they keep your teeth clean while you're in a coma? Oral care is incredibly important for comatose patients and people with feeding tubes. Suction is indeed used. Oral care actually reduces the risk of aspiration. My dad was in a coma for 7 years, and we were poor, so my mom and grandmother took care of him in our home because we didn't have insurance. She brushed his teeth every day with these minty foam things on a stick that was like a disposable toothbrush basically, and had a little machine that sucked the spit out through a tube. Nurses do it with suction. A lot of your gag reflex is involuntary. I am an ICU nurse. We do oral care every 4 hours on ventilated patients. Usually we take swabs or disposable toothbrushes with chlorhexidine mouthwash. And then we suction a lot of secretions. They brush your teeth, but do not use toothpaste, or very little. They also might use the little rubber brushes that they put on their finger to brush your teeth. Luckily, if you are in a coma, you are not really eating or drinking anything through your mouth. Hollow toothbrush with a hole behind the bristles, and vacuum, like the suction they use at the dentist. Keep in mind that you would be intubated. Nurses, aides, PWSs, or any of the other various healthcare workers provide oral care regularly. The nurses brushed my teeth. They are amazing and do everything for you. They actually make a toothbrush that attaches to suction. Oral care is incredibly important for a critically ill patient. Lots of ways to accomplish it. Although can't say I've ever seen anyone floss a patient lol. We brush your teeth every 2 hours, my friend. Oral care is super important while intubated and in a coma. That being said, it's not always done adequately, and I have seen some horrific mouths in my day. I am a CNA in a rehab setting where many patients have altered levels of consciousness or comatose. We have a variety of different oral care options ranging from regular toothbrushes for alert patients to styrofoam swab suction and devices dipped in hydrogen peroxide for people who are not awake or alert. Continuous suctioning keeps patients from aspirating. The harsh truth is they can't realistically keep up with the level of dental care other hygiene you normally get. Especially when they are fighting to keep you alive, your teeth are pretty low down on their lists of priorities. My dad was kept under on the ICU for roughly 7 weeks, and was bedridden in hospital for several months after. Although the nurses did their job excellently, there was still some damage to his teeth, muscles and ligament he had to recover from after being released from hospital. I suppose the body is made to be used. Oral care. We brush and suction your teeth and apply medications if you end up with thrush. We hate doing oral care. And tongue cleanser too. Sage trademark sign oral care kits. This user not affiliated with Sage trademark sign or its parent company. Sage trademark sign. Get that shit clean. I was in a coma for 2 weeks and there's no way they brushed my teeth. When I came out of it, my mouth felt terrible. One of the first things I did after being able to get out of bed was to ask for a toothbrush. They could have a nurse or dental hygienist brush and floss your teeth every once in a while. But on the other hand, if you're on a feeding tube and not actually eating with your teeth, it's probably not needed very often, if at all. Edit. I stand corrected, Yusu Naito. They call unsolicited fellatio. How exactly are the teeth getting dirty if they're in a coma?